Malaysia's Health Minister Khairy Jamaluddin has said that it is probably time for the country to begin living alongside the COVID-19 virus. With the number of new daily cases continuing to remain high, Jamaluddin said during a press conference on March 5, 2022, that the government would continue to enforce and re-evaluate existing public health protocols in defense against COVID-19, but with a view to helping the general public transition to a state of. He said that the effects of the virus on individuals have considerably waned, as evidenced by reduced hospitalizations and admissions to the ICU, as well as fewer deaths resulting from infections. This is a sign of our country's recovery from the COVID-19 pandemic. Malaysia also has a successful immunization rate against COVID, which is among the best vaccination coverages in the world, he said during the launch of the National Kidney Foundation of Malaysia's 16th Annual Dialysis Conference in Petaling. Khairy Jamaluddin at the 16th National Kidney Foundation of Malaysia Dialysis Conference 2022. Image. Malay Mail. He explained that the government's current emphasis was on equipping the country to better fight against the virus via new medical approaches, such as oral antiviral pills, prioritizing care for high-risk individuals, and coming up with the best protocols and treatment pathways for those infected with the. This coincides with the latest reports that Malaysia is set to receive 110,000 courses of Paxlovid, the new oral antiviral COVID-19 medication developed by Pfizer later this month, while there are suggestions that the country are also looking at alternatives from rival manufacturers, those being from AstraZeneca and. Prior to this, we only had vaccines, but now we will have antiviral to be administered to COVID high-risk patients, Jamaluddin said. So the weapons we have to fight the SARS-CoV-2 pandemic are increasing, and this encourages us to continue to press forward with recovery, with reopening safely, and more importantly to shift the focus of public healthcare not just on COVID-19, but also on non-COVID-19 matters as well. Malaysia will receive 110,000 courses of Pfizer's COVID-19 antiviral oral drug later in March 2022. Image. New Straits Times. The minister concluded that despite the high infection numbers now being observed, the country is already in the midst of transitioning to a stage where the virus can be considered endemic, mainly due to the less severe symptoms exhibited by those with the now dominant Omicron variant of COVID-19. He said that of the 300,000 or so active cases in the country, 96% were undergoing home quarantine, with many of them under categories 1 and 2, or already recovered. Yes, I still look at daily numbers, but more importantly, I look at the ICU capacity, hospitalizations, and number of patients who recover at home without having to visit COVID-19 assessment centers, CACs, hospitals, or quarantine centers, PKRCs, he said, adding that there was no more need to undergo mass lockdowns or movement control orders from now on. We are now in a transition phase to endemicity. As to when endemicity will be reached, that is something that needs to be interpreted technically. Read more life stories. The Tyrannosaurus rex was actually 3 different dinosaurs, study claims. Watch this Malaysian model effortlessly slay at Milan Fashion Week 2022. This egg white alternative is made of fungus. Cover image sourced from Tucson, Malaysia and Duck News.